Welcome to COVID Conversations, where we discuss the latest COVID-19 news with the experts. Recent travel guidelines from the CDC are giving Americans something to look forward to. The organization announced that fully vaccinated people can travel within the United States at low risk to contracting COVID-19. Additionally, fully vaccinated travelers do not need to get tested before or after travel, nor do they need to self-quarantine. At the time of this recording, about 22% of the US population has been fully vaccinated. But with COVID cases in the US on the rise, should people be so quick to book their flights? Lin Chen is the director of the Travel Medicine Center at Mount Auburn Hospital and an associate professor at Harvard Medical School. She joins me now. Dr. Chen, welcome.
Thank you, Nicole. Thank you for this opportunity to share some thoughts. Your question about, is it safe for people to travel? Well, if we have 20-some% of people who are fully vaccinated, that still leaves about 80% who are not. So we are not at the herd immunity where we can really interrupt transmission. So it's not totally safe yet. For vaccinated people, it is safer. But for those who are not fully vaccinated or who are unvaccinated, it's still not safe because of the variants. And the B.1.1.7, for example, we know it's highly transmissible, more transmissible and more lethal compared to the original virus. So people still need to take a lot of precautions when they're traveling.
Getting on a plane, particularly back early on in the pandemic, there were spaces in between seats on flights. Now that's not really the case. So when it comes to avoiding a crowd and people getting on a plane, how do we avoid that? Are there any things that someone can do on a plane in direct contact or close proximity with another traveler?
Right. So keeping your mask on, that's one of the most important things. And if people are seated more closely to each other, try not to lower your mask when somebody else is taking their mask off to eat or drink, because those are instances where somebody might be shedding virus and dispersing it nearby. And I think as far as drinking and eating on the airplane, try not to do it at the same time as your neighbors. Try to have your snacks someplace that's a bit away from others, if that's possible. For example, in a waiting area that's less crowded, perhaps bringing your own snacks, bringing your own drinks. I've been advising travelers to bring your own water bottle that you can fill at the airport, but with a spout so that you can drink it easily without taking your whole mask off. Perhaps these are little things people can do to minimize full exposure with masks off.
Excellent. Excellent. And, they were pretty clear that the CDC guidelines were pretty clear that they say traveling within the United States, within the US and US territories. So what about international travel? What about that long awaited trip to Greece or to France? What should we be telling folks who really want to get out of the country and are fully vaccinated?
Right. And I think the short haul flights are probably less risky in that you may not have to take your mask off to eat and drink as frequently, and or use some crowded settings and bathrooms, for example, along the way. And whereas the long haul flights might pose more risk in that you're traversing many time zones. You may be stopping over at airports, in other more crowded areas, as well as the flights where you might have to have multiple snacks or meals or drinks, and then getting to the other countries. There's still a lot of uncertainties about the vaccination rates.
People are excited. We know that the weather is getting warmer and everyone's excited to, they feel like it's been a long year, and they're ready to move forward and make those travel plans. But it's important to really, pay attention, take the right precautions, and maybe make it a road trip.
Yes. And then I still think road trips are probably safer because you can exert more control about where you stop, how you spend your time at a stop, how you plan your meals, drinks, and who you come into contact with. So I think short haul flights perhaps are people are eager to do, and that appears to be relatively safe or safer for people who've been vaccinated. But even with all the vaccines on board, it's still important. I can't emphasize it enough to wear the mask, wash hands, avoid crowds, do the physical distancing.
All the good stuff, all the traditional notes of caution that we've been told over the past year. Keep doing it.
Yes. And it is pandemic of the century. So I hope we don't have to deal with this for too much longer. And I think a little more patience on everybody's part as far as planning trips and planning them safely would really benefit everybody in the long run.
Excellent. Excellent. Really important information to share with everybody. I really appreciate your time, Dr. Chen. Thank you so much for joining me today.
Thank you for having me. Thanks again.
Of course. This is COVID Conversations, where we discuss the latest COVID-19 news with the experts.